Treatment for shoulder arthritis is all about the climb. Let's talk about this treatment using a rock wall. I'm Dr. Jadye Kee, and this is Bone Doc Talks. We're talking about shoulder arthritis today. So there's two different types of shoulder arthritis. So osteoarthritis, if we use that same analogy as the golf ball, is when you have a scuffed up golf ball. It's seen years of wear and tear, gradual damage on that smooth surface, just like a scuffed up golf ball that's been beat to heck over years. And then you have rotator cuff arthropathy, which is that same golf ball, and it starts off with the rotator cuff, which is the stabilizer to that golf ball on the tee, has seen a big tear, and it gets a toggle on that tee, eventually becomes a blister, and then that blister turns into arthritis. Now, arthritis can look very similar to osteoarthritis, like the scuffed up golf ball. It just starts a little differently. So if we can think of it like climbing a rock wall, we start at the bottom where it's safe, and then the summit's surgery, a little bit more risky up there. So let's focus on the bottom step. This has the lowest risk. If you fall here, you're not going to hurt anything. So, activity modification, we'll talk about staying in the box. A short period of sling immobilization may be needed, depending on what shoulder issue you have. And then physical therapy is the mainstay here to strengthen the shoulder and the rotator cuff if it's intact. Now, what is staying in the box? That is a box from your shoulder height to your navel to the outside part of your shoulders. If you stay in this box, this uses the larger muscles like the deltoid, the triceps, the biceps, to do the main movers of the shoulder, and you don't recruit the rotator cuff as much. If you get outside that box, you need the rotator cuff to really aid in balancing the shoulder. And if you get outside of that with heavy weight, you're going to hurt your shoulder. So that's staying in the box. Then we move up to the next level, which is medications. This is the same medications we've talked about before. Tylenol, Advil, some NSAID, maybe some topical gels, other medications when appropriate. There's some other things for pain medication that are coming out. However, the main issue here is inflammation, and we want to have some kind of anti-inflammatory to help out with the pain control and the swelling. We can stay at this level of physical therapy and medicines as long as we can. But if that doesn't do the trick, then we have to go to the next level. Each one has a little bit more risk. Now we're going into injections. This is involving a needle that's going into the shoulder joint and a medicine that's being introduced, whether it be corticosteroid injections, hyaluronic acid, gel, rooster comb, whatever you want to call it, some PRP biologics that are emerging. Some of this is dictated by some insurance things. Some of its treatments are hit or miss, the tried and true steroid injections, and so that's usually what we start with. Each of these are a patch, however, and you may have to go to the next step. Usually to confirm some things between this, we do some advanced imaging and planning our next move, whether it be surgery or not surgery. So advanced imaging like MRI or CT. That helps us look at the bony anatomy as well as the soft tissues. Once we're to this level, we've made the summit. This is surgery. What do we need to do? And so there's different options for the different things that we've found in your shoulder. So if it's just a massive rotator cuff tear or a small rotator cuff tear, a repair with arthroscopic portal holes, smaller surgery can be done, or even a spacer or a big augmentation for massive rotator cuff tears. These are bigger surgeries. If you do have an intact rotator cuff, but that ball's just been scuffed with arthritis, then you can do an anatomic shoulder replacement. It replaces the anatomy of what you had, but you have to have your rotator cuff. In the majority of folks, that rotator cuff is either deficient or not working well, or your arthritis is just really bad. That's when we really lean on a reverse shoulder replacement, which is the opposite. So the tee and the golf ball are switched in order to use some leverage of different muscles to make that shoulder function better with stability. And so those are the main options for surgery. It really depends on what you have with your anatomy, some of the advanced imaging we did, some of your treatment, maybe your age and activity levels. These things really factor in. The good news, though, is your shoulder is not a vital organ. All these things are elective. You don't have to have this surgery. The goal isn't to reach the summit, which is surgery. It is to find some treatment level along this wall that works for you and keeps you active and keeps you happy. If it's too risky or things are not going to work out to get to the top of the summit or different levels, that's okay. We just have to use things that are going to make you function better and move better. Hopefully this helps. And if you like this video, make sure to like and subscribe on YouTube for further videos. I'm Dr. Jadye Kee. This has been another episode of Bone Doc Talks. Keep those joints moving and grooving, and have a great day.